Good afternoon, everyone. This is Dr. Mowo with Cause L'école. As you know, every Sunday at this time, I come here to talk to you about a different topic with Cause L'école and mental health. So, as always, as you know, Cause L'école, we share information with you, and we believe that this information is invaluable to you and your family members and your friends. So all I ask for you to do is really to share that information with people who don't have the opportunity to listen to me live. So you can go ahead and share this live with them. Before I begin, as always, I'm going to invite my friends here, and give me a second. So that way we can get this going. All right, so I'm gonna go ahead and get started, and I'm sure that people will be able to watch our live after or join us. For the past 3 weeks, we spoke about the different personality disorders. We spoke about antisocial personality disorder. We spoke about avoidant personality disorder. Last week, we spoke about borderline personality disorder. So today we're going to talk about dependent personality disorder. So we're going to tell you what it is. We're going to talk about the symptoms. We're going to talk about what causes, what are the causes for dependent personality disorder. How do you get a diagnosis for dependent personality disorder, and whether or not there's any treatment for dependent personality disorder. So when you hear us say DPD, that means we're talking about dependent personality disorder. So what is it? What is dependent personality disorder? So it's a type of anxious personality disorder. So it's a type of anxious personality disorder. It's a mental health condition that involves an excessive need to be taken care of by others. A mental health condition that involves an excessive need to be taken care of by others. So that is, in general, what is dependent personality disorder. So what are the symptoms? What are the symptoms for somebody with this type of personality disorder? So people with DPD believe they cannot take care of themselves. They may have trouble making everyday decisions. They usually don't realize that their thoughts and behaviors are problematic. These people are typically passive and submissive because they don't want to cause conflict in their relationships. They have difficulty starting tasks on their own. They volunteer for uncomfortable tasks to get support or nurturance from others. They volunteer for uncomfortable tasks to get support or nurturance from others. They need others to take responsibility for various aspects of their life. They also feel uncomfortable when alone. They have a fear of abandonment and a sense of helplessness when relationship ends. They also interact only with the few people they depend on. They are more likely to tolerate physical, sexual, or emotional abuse because they don't want to lose the relationship. So this is all of the symptoms for somebody with dependent personality disorder. So what are the causes? What could cause someone to have that type of personality disorder? So what are some of the causes? So number one, this is somebody who has experience, who was abused as a child, including verbal abuse or neglect, right? Verbal abuse or neglect. Number three, it could be genetics. Somebody in the family, they could have a family member with DPD or another anxiety disorder, right? And they could also have certain cultural, religious, or family behaviors, right? And then due to the cultural or religious practice, they could develop DPD because these practices emphasize reliance on authority. So I'm going to repeat this last part. So due to the cultural or religious practices, those practices may emphasize reliance on authority, so that could cause someone to develop dependent personality disorder as well. So how do you get a diagnosis? Where do you get a diagnosis for that type of disorder? So you usually get that to either a psychiatrist or a psychologist or maybe even a mental health therapist. So how do you get a diagnosis? So you should have a persistent pattern of one of these, of the followings. So when you show a persistent pattern of one of the followings, then you could be diagnosed with dependent personality disorder. Number one, if you have difficulty making daily decisions without an excessive amount of advice or reassurance from others. Number two, if you need others to be responsible for the most important aspects of your life. Number three, if you have difficulty disagreeing with others because they fear the loss of support or approval. If you have difficulty disagreeing with others because you fear the loss of support or approval. If you have issues starting projects on your own because you're not confident in your judgment or abilities. If you are unwilling to go to great lengths, right? So if you have the willingness, to go to the great lengths, and that includes doing an unpleasant task to get support from others. So there are people willing to do unpleasant tasks so they can get support from others. So that is, you could be diagnosed with dependent personality disorder. There's more. Urgently needing to form a new relationship with someone who will provide care and support when a close relationship ends. If you show persistent pattern of any of these, you could be diagnosed with DPD. If you have unrealistic worry of being left to take care of yourselves, unrealistic worry of being left to take care of yourself, if you show persistent pattern of this, you will be diagnosed with DPD. So how do you manage DPD, and is there any treatment for DPD? So how do you manage it, and is there any treatment? So they usually treat DPD with psychotherapy. So psychotherapy will help you uncover the motivations and fears associated with your thoughts and behavior. So they use psychotherapy to help you uncover the motivations and fears associated with your thoughts and behavior. There are two types of psychotherapy. So the first one is psychodynamic therapy. So what is psychodynamic therapy? So psychodynamic therapy focuses on the psychological roots of your emotional sufferings, right? They use self-reflection to look into problematic relationships and behavior patterns in your life so you can have a better understanding of yourself. So psychodynamic therapy focuses on the psychological roots of your emotional sufferings. They use self-reflection to look into problematic relationships and behavior patterns in your life so you can have a better understanding of yourself. Number two, the second type of psychotherapy is cognitive behavior therapy. So cognitive behavior therapy, usually people call it CBT. So what is that? It's a structured, goal-oriented, where a therapist helps you take a closer look at your thoughts and emotion. So this is a structured, goal-oriented approach where a therapist will help you take a closer look at your thoughts and emotion. So when they do that, you come to understand how your thoughts affect your actions. You come to understand how your thoughts affect your actions. You can also unlearn negative thoughts and behaviors. You can unlearn negative thoughts and behaviors. And you can learn to adopt healthier thinking pattern and habits. You learn to adopt healthier thinking patterns and habits. And lastly, they help you focus on examining your fear of independence and difficulties with assertiveness. So they help you examine your fear of independence and difficulties of assertiveness. So these are the two types of treatment, the two types of psychotherapy that a therapist will use in order to help you with this disorder once you are diagnosed by either a therapist, psychiatrist, or psychologist. Are there any medications? Can you be prescribed medication for dependent personality disorder? Yes, you can be prescribed medication for DPD because people with DPD also deal with depression and anxiety. So they could prescribe you medication that deal with depression and anxiety to help you deal with your dependent personality disorder. So this was in large what dependent personality is. To go quickly over some of the points, it's really a mental health condition that involves an excessive need to be taken care of by others. So you have people who believe they cannot take care of themselves. They are typically passive and submissive. They have difficulty starting tasks on their own, right? They feel uncomfortable when they are alone. They are more likely to tolerate physical, sexual, or emotional abuse. So what are the four causes? So we saw that this could be people who experience abuse. They could experience childhood trauma. This could be genetics. It could be based on cultural, religion, or family behavior. So how do you get a diagnosis? So people with persistent pattern of any of these could be diagnosed with DPD. Difficulty making daily decisions, needing others to be responsible for them, issues starting projects, willingness to go to great lengths by doing unpleasant tasks, urgently needing to form new relationships, unrealistic worry of being left alone. So if you show persistent pattern of any of these, you could be diagnosed with DPD. And lastly, we saw the treatment are basically two types of psychotherapy that they could use with you. Psychodynamic therapy, where they focus on the psychological roots, right? And they can also use self-reflection, and cognitive behavior therapy, which is a goal-oriented therapy where they take a closer look at your thoughts and your behaviors. So I hope this information will be invaluable to you, and you will share this video with your friends and family, so they can also benefit from this invaluable information. So if you know anyone with who shows symptoms of DPD, encourage them to seek treatment, so that way they could become less depressed and less anxious, so that way they can have a better life. So this was Dr. Moreau for Cause L'école on this great Sunday. So I wish you guys to enjoy the rest of the day, and I will see you next Sunday at the same time at 3 p.m. Have a great week. Have a blessed week. I will see you next Sunday.